Hello, I'm Leah Tonkin with West Cancer Center, and I'm honored to get to talk to you today about lifestyle medicine and its implications for our patients with cancer. I have no conflicts of interest to disclose today. Today, we'll briefly cover an introduction to lifestyle medicine and its significance, then introduce the pillars of lifestyle medicine and their application to our daily practice with some final tips and takeaways. Lifestyle medicine is a growing field that focuses on using evidence-based lifestyle factors to prevent, treat, and manage chronic diseases. For our cancer patients, this can significantly impact their quality of life and overall prognosis by supporting their treatment and reducing recurrence. It is well documented that the United States is facing a chronic disease crisis. And according to the CDC, 6 in 10 adults in the US have one chronic disease, and 4 in 10 adults have 2 or more. We can certainly do better. This short list of modifiable lifestyle behaviors are drivers of most of the chronic diseases in the United States, according to the CDC. Of chronic diseases, heart disease, cancer, and diabetes are the leading cause of death and disability in the US, with an estimated 75 to 90% of chronic diseases that have been shown to be preventable by lifestyle modification, most particularly diet. Poor diet is the #1 contributor to early death in the US. So, how can we support our patients? While there are a wide variety of dietary patterns, most agree that diets that include an abundance of whole and minimally processed plant foods are preferable. Extensive research supports the incorporation of whole food plant-based diets as a strategy in the prevention of chronic diseases, treatment of chronic conditions, and in therapeutic doses, reversal of chronic illnesses. The focus on intake of minimally processed nutrient, fiber, and antioxidant-rich foods, and while decreasing the intake of saturated foods and trans fats, refined carbohydrates, added sugars, and chemical compounds. A 9-year study with 1,500 early-stage breast cancer patients revealed a 50% reduction in mortality for patients consuming at least 5 fruits and vegetables a day and exercising 30 minutes 5 days a week. One study by Farvid et al. Of 8,927 breast cancer patients revealed a 25% mortality reduction for every 2 servings of blueberries a week. Studies comparing the highest versus the lowest consumers of lignans, which are a compound found in cruciferous vegetables and sesame and flax seeds. In 1,122 breast cancer patients followed for 10 years, found a 51% reduction in all-cause mortality and a 71% reduction in breast cancer-specific mortality. These are easy changes to incorporate into our daily lives, and they can have a huge positive impact. I often share with patients that I actually count my fruits and veggies. Another pillar of lifestyle medicine is physical activity, and while we know that any activity is better than none, planned, structured, repetitive, and purposeful physical activity with the objective to improve or maintain physical fitness, performance, and health is ideal. ACLM supports the World Health Organization's recommendations that adults 18 to 64 perform 150 to 30 minutes of moderate intensity aerobic physical activity or 75 to 150 minutes of vigorous physical activity, or ideally a combination of both. Additional recommendations include that we add strength and resistance training activities of moderate or greater intensity 2 to 3 days a week. One of the ways I incorporate this into everyday visits is to casually bring up postprandial walking or activity as a mechanism to reduce blood sugar and improve overall metabolic health. And it sneaks in 30 minutes a day of activity in addition to their regular exercise program. But even if they don't have a regular routine, this helps positively introduce them to activity that's easily accessible. The CDC notes that people who are physically active for 150 minutes a week have a 33% lower risk of all-cause mortality than those that are physically inactive. And cancer.gov notes that observational studies suggest there's strong evidence that higher levels of physical activity are linked to lower risks of cancer, such as bladder, colon, breast, and kidney. And a meta-analysis of 12,000 patients demonstrated that physical activity reduced death caused by breast cancer by 34%. They also saw a 24% reduction in recurrence and a 41% reduction in all-cause mortality. These numbers are worth getting out there for. NEAT is non-exercise activity thermogenesis, and it's often overlooked as a tool to help optimize our health. Say in the perfect world, we schedule 1 hour for formal exercise like cycling, running, or a class. If we allow 8 hours for optimal sleep, this leaves us 15 hours to increase our informal activities. The three main components that make up our energy expenditure are basal metabolic rate, which makes up about 60% of daily expenditure for sedentary individuals, diet-induced thermogenesis, physical activity-related thermogenesis, which is the most variable and can give us a great return on investment. And the science backs it. Perhaps it's because you don't need to beat rush hour, pack a gym bag, or book a class. A study of 32,000 teenagers in China showed that the rate of adoption of daily changes in NEAT was much higher than exercise programs. What are the actual benefits? The Osaka Walk study in Japan followed 6,000 men over a 10-year period and showed that those that walked 20 minutes or more to work had significantly lower rates of hypertension. And worldwide studies have showed that those with higher levels of NEAT have lower rates of impaired glucose, diabetes, and obesity. So tell your recruits at work and home that these changes are backed by science. And as Kinetica Sports so perfectly stated, NEAT can help you add marginal gains to your health, fitness, and well-being in a straightforward and achievable manner. Restorative sleep has received a lot of attention lately, which is exciting. We have a multitude of trackers to choose from these days, and we may leverage this technology to optimize our sleep habits. Sadly, a large percent of our population have insomnia, with nearly 1/4 survivors of childhood cancer experiencing difficulty falling and staying asleep, according to Johns Hopkins. The National Council on Aging reports up to 30% of adults have insomnia, and for 10%, this interferes with their daily activities. High quality restorative sleep is essential for health and well-being. Unhealthy sleep is associated with the most common causes of premature death and disability, and in many cases is directly responsible. A progress report on cancer.gov reports that poor sleep health is associated with poorer treatment efficacy, adverse physical and mental health outcomes, and increased mortality in cancer survivors. The ACLM supports the American Academy of Sleep Medicine recommendations that most adults should sleep 7 hours or more per night, ideally in alignment with their natural circadian rhythm for optimal health. The National Sleep Foundation puts upper limits of sleep on for adults at 9 hours, as excessive sleep is associated with stroke and other conditions. Stress management is of utmost importance these days, as the chronic stress of modern society has made it more difficult to practice healthy lifestyle habits and can exacerbate health issues such as cardiovascular disease, insulin resistance, sleep deprivation, depression, anxiety, weight gain, and more. Chronic stress can cause poorer overall quality of life, decreased job and school performance and satisfaction, and lead to mental and physical health issues. Approximately 70% of visits to primary care providers are related to stress and well-being. And as we all know, when we do experience stress, it is much harder to engage in or maintain healthy habits. Some simple breathing exercises can help us cope with everyday stressors, such as box breathing, which is breathing in for 4, holding for 4, breathing out for 4, and holding at the bottom for 4 seconds before taking another breath. There's also 4-7-8 breathing. These practices can help downregulate the sympathetic nervous system and activate the parasympathetic, helping us feel more centered and in control. Additional tools are yoga nidra or non-sleep deep rest sessions, and these can also help restore us. While there's not a clear link that stress leads to or causes cancer, it can make it harder to stick with healthy lifestyle changes, which can increase the risk of cancer. Social connection is crucial for our physical and mental health. It can help reduce the risk of heart disease, stroke, cancer, dementia, anxiety, and depression. Animal studies have linked social isolation to tumor growth and metastasis, and in human studies, lower levels of social connection are linked to poorer survival from breast, colorectal, and lung cancer. Social connection reduces stress, and having a strong social connection can help anxiety, which can have an overall impact on our health. It also boosts our immune system, making us less susceptible to illness. It helps us feel connected to others and can help our ability to manage stress, anxiety, and depression. And it encourages healthy behaviors. Having a healthy support system can motivate us to make healthier choices, such as eating well and exercising regularly, and even exercising together. It also provides emotional support during difficult times that will help us cope with challenges. Social connection comes in many forms. It can be brief day-to-day interactions with strangers, as smiling is contagious, and a simple smile with a stranger can increase dopamine and serotonin and reduce cortisol and adrenaline. And according to Harvard and the Proceedings of the National Academy of Science, optimism, which is often linked to smiling, can help you live longer and is linked to a lower risk of early death from cancer and infection. So being present and even briefly connected with strangers in the grocery store or in the office can help you both. Risky substances. The use of tobacco, alcohol, and non-prescription medications have been shown to increase the risk of chronic diseases and death, and treatment often takes time, different approaches, and many attempts. Patients and support are important. Patients and support are an important part of breaking risky substance habits. The ACLM supports the positions of the National Institute on Drug Abuse for the treatment and substance abuse and recognizes the research showing that the level of alcohol consumption that minimized harm across health outcomes was zero. Cancers with the clearest link to alcohol include head and neck, esophagus, liver, breast, and colorectal. But at least for smoking, the good news is 70% of smokers want to quit, and effective treatment exists. And although it may take many times and attempts. And also good news for alcohol. According to a 2024 survey, 41% of Americans are trying to drink less, and this is a 7% increase from 2023. Many contribute this to the sober curious movement, where people are drinking less or not at all, and there's been a rise in mocktails and non-alcoholic options. And good news for us, the reasons listed are to improve physical health, make a lifestyle change, improve mental health, lose weight, and save money. These are exciting changes. So now about applying this to our interactions. I know they always told us in training that the patient will tell us what's wrong if we just listen long enough. I don't know about you guys, but I really have found this to be true. And they will also tell you what they're willing to work on, allowing us a window into them and a door to walk through and help them. Ask them what is their confidence level that they can achieve this goal and how important is it to them. You can use a simple 1 to 10 scale. If it's say a 7, ask what would it take to bring this up? And then ask them to summarize their goals and ask what resources they might need or what obstacles they might run into. You can problem solve with them if needed. One strategy is to use SMART goal format, but you can also use learning goals, which focus on obtaining the skills needed to employ new behaviors, such as what benefits of this behavior change do you value the most? What would help you stay on track with these changes? And what strategies can you use to overcome obstacles? Connect patients with available resources and programs, and confirm the patient's commitment with the action plan. You could even consider having them sign it. SMART goals are a great way for us to introduce positive activities without having patients feel overwhelmed. These goals are specific, measurable, achievable, relevant, and time-bound. An example of a positive activity goal would be, I will walk with a friend or a family member for at least 10 minutes a week, 10 minutes after dinner, 3 times a week. So final tips and takeaways. Nutrition. The American College of Lifestyle Medicine recommends a plant-forward eating pattern, and a good place to start is to discuss the supporting data on 5 fruits and veggies daily. Physical activity. The recommendations are 150 minutes of moderate exercise or 75 minutes of vigorous activity weekly, in addition to 2 to 3 sessions of strength resistance training. Restorative sleep, 7 to 9 hours per night, is associated with optimal health. And stress management, finding ways to help patients cope with their everyday stressors can improve their treatment efficacy and overall well-being. Social connection, ideally finding daily meaningful interactions with others, and avoidance of risky substances. In an ideal world, eliminating or minimizing alcohol, tobacco, drugs, and risky behaviors. Lifestyle medicine gives us tools to gently guide our patients through the sea of overwhelming information they are getting. It puts them first and in control of their lives and helps us deliver more effective and compassionate care. And here's just a list of resources. Um, and the first is Sammy Mansfield's website. She was your wonderful dinner speaker last night, and she has dedicated her career to using lifestyle strategies as a key component of clinical care to enhance the lives of those that have faced cancer. The next resource is just a brief 6-page overview of lifestyle medicine, and there's even a link to free CMEs up here. The last resource I'm hoping you can access. It is a great simple one-page handout that you can give patients if they are wanting to dip a toe into lifestyle medicine, wade in, or jump all the way in. So let me know if you cannot access those. Thank you so much for your time today. It's been an honor to be here. Please feel free to ask any questions or contact me at ltonkin2@westclinic.com.